Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to show you a before and after of a patient who got braces in our office. This patient had an overbite, so we'll show you how overbite correction is sometimes done. We'll talk to you about the whole process, why we chose this specific treatment plan. So let's go ahead and get started. So I'm going to talk you through this video as we go through these slides. We'll show you the actual photos of this patient. And this is the first day that we saw her in our clinic. As you can see, she already has braces on her teeth. So she had actually started braces at a different office, and she had been in braces about 3 years at this point. So as you can see, she has straight teeth, but at this point the overbite has still not been corrected. So they had been trying to do rubber bands for quite a while, but they hadn't really been successful. So they transferred their office looking for a way that they can fix this overbite. As you can see, it's a pretty pronounced overbite, and we looked at the different options. So whenever we're looking at overbite correction, there are a few options that we'll consider. So these are 5 options that we might consider. So one is a Herbst Appliance, another is a Forceps Appliance. Sometimes it can be fixed with elastics or rubber bands. Jaw surgery is also sometimes an option we consider. Then also extractions. And so I'll talk you through these different options, kind of show you our rationale for why we chose the one we did. So for those who aren't familiar, a Herbst Appliance looks like this. It basically is an appliance that helps to posture the lower jaw forward in hopes that the patient will grow in that direction, and we can correct the overbite through getting jaw growth. So our patient was already late into her teenage years, and so she was already past the window of when we could expect much growth. So in her case, a Herbst Appliance wasn't really going to work because she was already past the growth phase. So that wasn't really an option in her case. Next things we might consider is a Forceps Appliance or Forceps springs. As you can see in this photo, Forceps springs will work by pushing the top teeth back and the bottom teeth forward. In this patient, you can see her lower front teeth have already been pushed forward, and you can see she's starting to get some pretty thin gums. So one of the side effects of a Forceps spring is it can really push those bottom teeth forward. In her case, we were worried that pushing those teeth forward anymore might lead to some gum recession. So we didn't think this was an ideal treatment plan for her case. So next, like I said, elastics are an option. They had actually been trying elastics at her previous office for about 3 years. As you can see, it hadn't been real successful. Elastics do work the same way as a Forceps spring, where it pushes the top teeth back and the bottom teeth forward. And in her case, there was just really nowhere else for those lower front teeth to go. So we didn't feel like this was going to be the best option for her as well. So jaw surgery is something that we discussed with this patient. Jaw surgery will work. It works by basically moving the lower jaw forward rather than moving the teeth. So it can be a great option for overbite correction, but it is an option that is very invasive. There's a lot of things that go into a jaw surgery. It's very expensive, and most patients it's just not really within reach. So we only do a few jaw surgeries a year, and we discussed this with this patient, but it wasn't something they were interested in, so they asked if there was any other options that we could do. So we decided to go with extractions. And so I'm going to show you a video that shows you which teeth we extracted, how it works, and why that was the best decision for her. So I'll go ahead and start this video here. So as you can see in the video, anytime that your front teeth stick forward, one way to bring those teeth back is by having 2 teeth extracted on the top. It is the first bicuspids. And then using braces, we can slide those front 6 teeth back and correct the overbite. So this animation will demonstrate that. So you can see these front 6 teeth slide back, and by the time everything's finished, the overbite's corrected and all the spaces close as well. So that's what we decided was the best option for this patient. We didn't have to worry about pushing those lower front teeth forward. We didn't have to worry about her growth. We could take 2 teeth out on the upper arch, slide the front 6 teeth back, and so that's what we decided to do. So you can see this is the patient before again. You can see her before photos, that straight teeth but a very large overbite, very protrusive front teeth. She really didn't like her smile. And so we took out 2 teeth on her upper arch. And then in about 12 months later, you can see the overbite was totally corrected. This is where the teeth were extracted. And as you can see, the space is completely closed and it's totally transformed her smile. So we'll show you some before and after photos here. You can see the before photos with the large overbite, the teeth were sticking out. Then afterwards, after the space was closed, she had a great smile, space is closed, And as you can see, sometimes one of the side effects of closing space is the gums get a little bunched up here. So you can see the gums were a little heavy. That is something that goes away with time, and over time that will get better. So that's one of those short-term side effects of closing spaces with braces. Here's some more before and after photos. One thing I get a lot of questions on the YouTube comments is, does taking teeth out ruin my face? Does it flatten my face, flatten my lips? Is it gonna change the jaw support? So as you can see with this patient, she had 2 teeth taken out on the top, and I believe it actually improved her profile. That upper lip on her before was quite protrusive, and so it actually improved the profile by bringing that back. So in most cases, taking teeth out for braces is actually beneficial to the profile and doesn't really have any negative side effects. This is something we take into effect whenever we decide, do we need to take teeth out on this patient or not? And is this the best option? We look at the face, we look at the profile, we look at the lips, decide is the best long-term option for her. In her case, as you can see, she had a fantastic result, a beautiful smile, and her profile, I think, was improved by this treatment option as well. So that is before and after of braces treatment for overbite correction with extractions. If you have any questions about this treatment plan, feel free to ask them in the comments section below. So if you found this video helpful, please give it a like. It helps our channel grow. Also, please subscribe to this channel for more braces related content. Make sure to tap that bell. Thank you so much for watching. We'll talk to you soon.